Hello, I'm Dr. Sonia with Heritage Wellness, and in this video, I will talk about how your brain heals trauma without reliving it and EMDR therapy. Alright, so you've done therapy, you've read the books, you understand on an intellectual level exactly why you feel the way you do, right? And yet, the anxiety still comes, the memories still ambush you, the body still braces. If that sounds familiar, I want you to understand something. That is not a failure of effort. That is a failure of method. And there is a reason, a neurological and biological reason, why talking about trauma can only take you so far. Today, I want to show you something different. And as a board-certified holistic psychiatric provider, and in a few minutes, I'm going to explain exactly how EMDR works, what it does inside your brain, and why so many people describe it as the first thing that actually worked. Here's what most people don't know about trauma. It doesn't live in your thoughts. It doesn't live in your memories the way ordinary memories do. Trauma lives in your nervous system. Trauma lives in your body, in the structures of your brain that govern survival, not language, not logic. Now, talk therapy can help you understand this. EMDR can actually change it. EMDR stands for Eye Movement Desensitization and Reprocessing. I know it's a mouthful, but the concept underneath it is actually elegant. It works through what we call bilateral stimulation, alternating sensory input that activates both sides of the brain, left and right, simultaneously. That might be guided eye movements, gentle tapping on your hands, or alternating tones in headphones. What this does is activate the same neurological state your brain enters during REM sleep, the stage of sleep where your mind naturally sorts, processes, and integrates the day's experiences. In other words, EMDR doesn't ask your brain to do anything that it doesn't already know how to do. It restarts the processing that got interrupted when the trauma or traumatic experience occurred. And what clients experience in session is often remarkable. A memory that felt enormous, that made your chest tighten up just thinking about it, begins to feel smaller, more distant. The physical grip of it softens, and something new emerges, often in its place. A different understanding of yourself and a shift in how you hold what happened. You are not being asked to relive your trauma in detail. You are not given homework. You don't need to put what happened into words. What we are doing is giving your nervous system the condition it needs to complete what it started. As a board-certified psychiatric provider, I can look at the full picture. I can assess whether there are biological factors like inflammation, hormonal shifts, medication interactions that are limiting your nervous system capacity to process. I can determine whether a careful psychiatric support strategy might actually make your EMDR work more effective. I can hold the somatic, psychological, and the biological all at once. Because here's what I've learned after years of clinical work. Trauma doesn't heal in a silo. It heals when the whole person is seen. Body, mind, history, and context. That is the foundation everything else is built on. So, if you've been carrying something that hasn't resolved, no matter how long you've been in therapy, no matter how well you understand it, I want you to know this. Understanding is not the same as healing, and you deserve actual healing. EMDR is one of the most evidence-based, deeply effective tools that we have for doing that. It has been endorsed by the World Health Organization, the American Psychiatric Association, and the Department of Veterans Affairs. And in my clinical experience, I have seen it change lives in ways that nothing else had. So, if you'd like to find out more about EMDR and how we can best support you, we'd love to connect. Visit heritagewellnessus.com. We'll take the time to understand your history and figure out whether EMDR or one of our intensive programs is the right path for you. And if you found this video helpful, share it with someone who might need to hear it. Sometimes the people we love the most are the ones still waiting to discover that healing is possible. Well, I'll see you in the next video. Take care, everyone.